Good evening. This is Dr. Jha. For a change, I know I've been on Facebook Live, and my team, the wonderful team of educators, have been talking about hypertension, diet, and so many other aspects of reversal of type 2 diabetes. And I apologize those who expected to me on that Facebook Live, but I couldn't be there because of my engagement. But I thought doctors keep talking, and sometimes it's good to have educators talk about because they do understand diet and exercise much more than what we do understand. And today I want to talk about diabetes and kidney disease. We would not we will not hate diabetes if it's not causing a trouble. And I keep saying it. There could be some repetition. Diabetes is the cause which causes more, 2, 3 times more risk of heart attack, stroke, kidney failure, retinopathy. So if diabetes is not causing all this, what is diabetes? Diabetes is nothing. Blood sugar 400, I keep talking like you. And if it's not affecting my organ, I would not bother about it. Mainly because we do understand that diabetes ultimately can lead to different organ damage. So today is more topic about flavoring on the kidney disease. You can see that, we could be one of the largest number of diabetes kidney disease in the world in the next 10, 20 years time because the epidemic which started 20, 30 years ago would create kidney disease tomorrow. So the kidney disease, usually a pure diabetes kidney disease would not happen overnight. It takes 5, 10 years, 15 years, 20 years time to create kidney disease. So what are the risk factors for diabetes kidney disease? Obviously, a poorly controlled diabetes, hypertension, very important. Not controlling hypertension, but certain class of medications we call hypertension and ACE inhibitors, high salt intake. And if you're taking any painkillers like brufen or something like what we call as NSAID group, and also, I'm not scared of saying that, but taking all these alternative medications promoted by big babas and big gurus, which they don't know that what might contain, has got some compounds, metal compounds, which can damage kidneys. It's been proven again and again. We as an Indian don't believe in that, but that's very unfortunate that these drugs are causing damage to the country. Dr. Sujeet Jha, is telling that there's certain drugs that we prescribe can damage your kidney. In the same breath, I'm also telling that certain drugs which is prescribed in Ayurveda and certain compounds which people take it over the counter can damage your kidney. So it's not that somebody else is damaging kidney, that we also have brufen, like even ketorol DT medications, type medications people take for your dental thing, can damage your kidney. So it's very important to avoid what can damage your kidney, because if you have diabetes, very important that you avoid any drug which can damage your kidney. Even certain antibiotics can damage your kidneys. You have to be very careful, consult your doctor that you can't just keep throwing antibiotics to your body and that can damage your kidney. So first aspect, that how the diabetes and the kidney damage can progress, it takes 5, 10 years, 20 years time. Now, how do we know that your kidney is being damaged? My kidney function don't go to 10% of the total function to understand, to go for me to go to a doctor here, to Dr. Grover here, a nephrologist, to say, look, I've got a kidney damage, look at my swelling. By the time 90% of the kidney is already gone. So diabetes kidney damage happens slowly. It's not symptomatic. The kidney profile needs to go down to less than 30%, 20% to cause symptoms for you to go and visit the doctor. We look at the creatinine as a wonderful marker for kidney disease. Even somebody's creatinine is 0.7 to some of the lab would say 1.1. For a 40, 50 years guy, a 1.1 creatinine can be high for us because what we are worried about when he's going to be 60. So creatinine is the best marker. But to look for kidney disease, we look for proteinuria or albumin creatinine ratio, microalbumin, or urine protein. Urine protein leak in the micro levels are indications for early kidney damage. Usually we repeat twice. Once we repeat, we need to repeat twice to call it positive. If you have protein leak and your creatinine can be normal, then we can still cause it diabetes kidney disease, because that's a marker for kidney disease. Not to 2020, but 2030 you can have kidney failure. So you must get your routine test done, which includes HbA1c, which we have discussed before, lipid profile, kidney function, liver function, thyroid function, leukoprotein for the case, and also the retina. It's very important to look at the back of the eyes because diabetes kidney disease is associated with retinal disease. Large number of patients will say, look, I can see, I have no problem with glasses. Why the hell you doctors are keep advising you refer to the other doctors? Merely because retinopathy is very important to understand that have you got a retinopathy or not. So doing the standard test, which I'll keep repeating, HbA1c, sugar, lipids, HbA1c, thyroid function test, microalbumin, urine, retina test on a routine basis. And if you have proteinuria, and if you don't have hypertension, we tend to repeat proteinuria in 6 months' time to understand that any proteinuria is going on. Now, if there is a proteinuria, then it means you have a diabetes kidney disease. Most people will have hypertension with it. And there are certain class of medication which will end up as sartan as a salt or pril as a salt, like ramipril, captopril, enalapril. A lot of drugs are there which can protect your protection. The diabetes kidney disease is progressive. The diabetes, the kidney tends to decline by function by age anyway. So it's not that kidney doesn't decline by function; it tends to decline by age. And if you have a proteinuria, the diabetes kidney tends to decline much earlier, and you can have any kidney failure at much younger age. Most people have a good kidney which can survive for 100 years. The question is that's why we donate kidneys, that we have enough kidney reserve which God has given. So if I donate my kidney at 50, I can still have a normal life with that one kidney if I protect it well. That's why people donate kidneys. So that because the God has given enough reserve year of kidneys so that we can survive on one kidney as long as we protect it. God has given two kidneys. If you have diabetes, blood pressure, cholesterol, smoking, high salt intake, you can damage kidney within 40 or 30 years time. We see a large number of people in 30s and 40s in India because their diabetes and blood pressure has not been controlled. So the most important aspect is to get your test done and get the treatment done. Now, how do we treat diabetes kidney disease? Or in other words, how do we protect that you don't get kidney disease? By controlling diabetes, that's very important. By controlling blood pressure, it's very important that if you don't control blood pressure and diabetes, no point controlling sugar control. So it's very important. And sometimes it becomes the priority number one more than the glycemic control, the control of blood pressure to level of 130 by 80. No doubt, no controversy in that. Let's not get there. 130 by 80. Okay, period. That's it. 130, 80, I will lower blood pressure. And controlling agents by sartans like telmisartan, valsartan, or other medications, or a ramipril or enalapril, don't start it based on this case of discussion. You have to discuss physician to a maximum tolerated dose. That tends to protect your kidney, and that will delay the progression. It may not reverse it. That may delay the progression. Mind it. And normally, these side effects that sometimes some people out of 100, the creatinine can jump more than 30%. Then you have to be very careful about discuss with your doctor, and then that can be retitrated. Speak to the nephrologist, speak to your physicians who can retitrate and rethink about withdrawing that medication. So always when you start this new medication, the blood pressure, you always do a kidney function test in 7 to 10 days time. And it's very important to follow them up. And these medications tend to protect controlling diabetes by medications. And there are certain class of medications called SGLT inhibitors, which includes like Zardians, empagliflozin, dapagliflozin, and other class of flozin drugs, which are a little expensive, are also been proven to protect your kidneys. Mind it, the canaflozin is a newer study which has found that diabetes drug, which controls diabetes, which throws the drug which works by mechanism by throwing glucose in the urine, have also wonderful protective effect on the kidneys. So those patients who have a proteinuria and the blood pressure, the certain blood pressure agents and certain class of medications like SGLT inhibitors, which you don't have to understand it deeper, that you can discuss with your doctor, can help to protect your kidneys. Besides controlling blood pressure, diabetes, certain medications can protect your medications. Besides, statins group of medications also protect kidneys because lowering the cholesterol also helps the kidney protection. Now, going back to what are the dietary measures? Now, there is a concept that once you have protein leak, cut down the protein leak. Today I had this discussion, and people don't understand that you don't have to restrict protein. On average, even if you have frank kidney disease, the protein restrictions 1 gram per kg body weight. For 70 kilograms, you have to eat 70 gram protein. With 70 gram protein is a large amount of protein that will be very difficult to take. So It's very important for you to understand that proteinuria is there. You don't have to restrict large amount of protein, that you don't need to eat dal, all that stuff. That's wrong. You can consult your dietitian, but a 70-gram protein for an Indian patients, even vegetarian or for that matter non-vegetarian, is very difficult to go beyond 70-gram protein. So do not take extra protein, but do not cut down protein to zero. Take normal amount of protein, which is important. The most important aspect in preventing kidney disease is salt intake. And I think Sakshi and Manju has earlier has discussed about the salt intake on a DASH diet, which is no salt is important, almost negligible of salt. We don't need a salt. Salt is there everywhere. Whatever food we eat, including mango or a palak or a rice, it has got salt in it. We add salt while cooking, then we add a table salt when cooking. That's more harmful for your kidney, for blood pressure, and that's very important to cut down your salt to minimum. And if you're not working outside, if you're not sitting outside, you're not playing football or metro, or you're not working for the metro station, majority of time you're living in the air conditions or partly in the air condition, you don't need extra salt. That's very important. The salt needs to be cut down. So the blood pressure control, the sugar control, certain medications and blood pressure medications are very important. But controlling blood pressure by any agent, any medications to a 130/80 level will protect your kidneys. Diabetes control by any medications will also protect your kidneys, but certain class of medications, which is near been proven, newer evidence like canafloxacin, empagliflozin, which you don't have to remember. You have to speak to your doctor. Please do not start buying medications online and start taking those medications without the consultation of your doctor. These are very much kidney protective. This is the newer evidence which has come up. Along with that, the diet, low salt diet, high fiber diet, the diet remains the same. High fiber diet, low salt intake, less saturated fat, which is what we call as a DASH diet or the standard diet for diabetes, which we have discussed, Manju and others have discussed before regarding diet. So it's very important to understand these factors important. So whenever your kidney functions, if your doctors have told you that you have protein leak and you have a creatinine going up, it's very important to get your kidney function tested. Now, once you get a creatinine level, please get your EGFR tested. Some of the labs, Max Lab or even Lal Lab, would do your EGFR, a calculated GFR value. It is tells you that how much his kidney is functioning. And you normally should be 90 to around 90, between 60 and 90. If it starts going down below 60, you should be definitely worried person, and you must see the nephrologist. So an average kidney function should be around 80, 90 or around 100. If it's going down below 80, you should be worried about it. And that calculated EGFR also depends upon age and different factors. And you should be able to discuss with your doctor about this EGFR. Okay, this is a calculated glomerular filtration rate that tells you the function of the kidney, and that must be calculated. You can go on mdrd.com, type your creatinine, type your age, type your race, which is most of you will come in non-black race or black race. They'll ask you to put your age, and they'll be able to calculate EGFR. Make sure you calculate and look at your normal EGFR, what it should be, and it should be done on a routinely basis. So, in summary, diabetes affect your kidney chances 2 to 3 times more. Most people in the Max Hospital or any hospital who are on dialysis today, they have more than 50% have diabetes. Why they have ended up in diabetes, kidney disease, or a kidney transplant or a dialysis? Mainly because they didn't sorted their diabetes out, blood pressure out, the cholesterol out, the certain blood pressure agents, or they have been careless. You cannot damage diabetes, kidney overnight with blood sugar of 400. A lot of people worry, oh, blood sugar is 400 would damage kidney tomorrow. Not at all. It's a long-term damage. It doesn't happen overnight. So it's very important to understand that diabetes needs to be controlled, the blood pressure needs to be controlled, the diet needs to be controlled. Walk 30 minutes a day would have indirect benefit to your blood pressure, sugar control, and ultimately the kidney disease. So whenever I talk about any illness, either a cardiac disease or a kidney disease, the diet remains the same, the exercise remains the same, and there are medications which is common. But at the same time, those who have family history, those who have protein leak of the kidney disease, it's very important. Those who have previously uncontrolled hypertension, those who are taking offline medications for painkillers for several reasons, you must be very careful about it. Now, if you have diabetes or no diabetes, I must tell you what is the best painkiller. The best painkiller, safest painkiller is what everybody believes is a fever medication, paracetamol. Paracetamol 1 gram, 1000 mg. I'll repeat again. Paracetamol, 1000 mg, up to 6 hours is one of the safest painkiller. I'm not saying you should start taking it tomorrow if you have any pain, but this is one of the safest painkillers that what we have. And the other stronger medication which has to be prescribed by a doctor are tramadol. People take Ultracet, but they also have tramadol and paracetamol combined together. So it's very important to take paracetamol is the safest painkiller. I know it is antipyretic, which brings your fever down, but also a safe, mild painkiller. But you have to take 1000 mg. If you take 500 mg, it's not safe. There's not much of allergy reaction to it. It's a stomach friendly, it's a kidney friendly medications. And paracetamol is a good painkiller to have. Those who don't have kidney disease or those who have it should always avoid what we call as NSAID group. Please look at the net. If you're taking NSAID group, non-steroidal anti-inflammatory drugs, or COX-2 inhibitors, they are also not friendly for the kidneys. Those who have a dental painkillers, we see a lot of patients practically jumping up. I know a dentist who has come from Patna who has a kidney failure just because of they've taken a one medication for anti-inflammatory medications and the kidney failure. Again, going back to Babas and Gurus who are seems expert on everything, they don't understand what is kidney, they don't understand what is kidney functions, they don't understand creatine. We take 10 years to understand all this stuff, but some of they understand in sitting and doing some yoga and exercise, they understand the kidney functions as much as we understand. Somebody has to be fooled. Either we are fooled, it takes 10 years to understand all this, or they are fooled. Because they think they know everything by doing, भगवान की पूजा and creatinine के बारे में सब कुछ उन्हें मालूम चल जाती है और हमें कुछ नहीं मालूम उन्हें सब कुछ मालूम. So somebody has fooled. So if you accept I'm fool, shut this video. Don't listen to me. If you think they are fool, don't listen to them because they misguide you. They don't understand the creatinine. Okay, in my previous Facebook, I do get disturbed about when I listen to all this that there's a kidney medication, Ayurvedic medication, or creatinine to improve ho gaya. The whole fundamental of kidney function test has been named by the mainline science. The Ayurveda or homeopathic or any alternative medications or Unani medications have not been based on the creatinine. My creatinine is 0.7. How would I know? How any Baba Guru would know my creatinine is 0.7? Do they know about it? It means they have been born with such a big brain that they understand more than what we could understand in last 30, 40, 50 years time. So please do not listen to them. One of the biggest problem in the country is that they listen to them and they damage the kidneys and they still go back to them and they get these Ayurvedic medications, damage the kidneys further. At the same breath, I keep saying there are medications that we prescribe or your doctor can prescribe can cause kidney damage. So be careful. Ask your doctor that, look, I've got a diabetes. I've got possibility of the diabetes kidney disease. Can I have any of these medications can damage kidneys? And your doctor must answer that, which could be simple antibiotics, which could be any medication that what you prescribe for any conditions, be it dengue fever or be it malaria, warn them. Because diabetes kidney damage happens or a kidney damage happens, it can't be reversed. Most kidney damage can be partly reversed, but once kidney damage happens, it remains like that. And if in 40s and 50s, it can progress into bad kidney failure. It's an expensive affair. You need a dialysis. You need so many other things. But at the same time, your quality of life gets affected. If any of your family members have diabetes kidney disease, they will see that how much suffering is there. People die early. People have heart attack, stroke. You have to come to what is diabetes kidney disease? You have to come to the hospital 3 times a week. 3 times a week, 4 to 6 hours. Come to the hospital, spend money, and get your dialysis done. Do you think that's easy? No, it's not easy. Do you think dialysis at a renal transplant may cost 6 to 8 lakhs approximately? Any hospital you go in the Western world, it might cost 1 crore. So the question is, the kidney transplant is a tough plant. You have to take immunosuppressant, a lot of medications all your life. You need to be observed by a nephrologist under great observation. Otherwise, the kidney transplant survive. I'm not saying that's not a choice. Yes, that's a choice. You need dialysis, you need dialysis. You need transplant, you need transplant. My main view is, as a diabetes endocrinologist, we need to make sure you don't end up there. To end up there, it's very cheap. Get your diabetes control, get your blood pressure control, get all those medications which I was talking about. Keep watching your kidney function test. Keep looking for leak of protein from the kidneys called microalbumin. Get your retina test done. Cut down your salt intake, high fiber diet, walk, exercise, so that you don't end up in kidney failure, either dialysis or renal replacement therapy or renal transplant, which is a very expensive affair. Not being expensive affair, it makes a quality of life. You have to be in touch with the doctor. So prevention of heart disease, prevention of kidney disease remains the primary importance of us so that we can protect you. Now, in matter of, I keep always talking about a little of controversy about it. We say, डॉक्टर साहब ये महंगी दवा है, ये डायबिटीज की दवा है, आप इतनी महंगी दवा देते हैं. But you have to look at the cost, health economics cost of a kidney transplant, a kidney failure. Now, everybody I treat in diabetes who has not poor control would not end up in kidney failure. God knows who will end up. There are some genetic predisposition. There are family disposition which make you a kidney failure. But we don't understand. Those who drive fast, we tell them to slow down. Those who drink alcohol, we tell them to cut down the alcohol. Who gets to alcoholic liver disease, God knows. Who will end up on the Jaipur highway killing himself by driving fast? We don't know. Not everybody dies. But we tell everyone to slow down your car speed. If somebody drinks excess alcohol, we cut down the slow alcohol, cut down the alcohol intake. Same thing with diabetes. Who have a poor control, who have a blood pressure poor control, we tell them for our point of view, everybody has got potentially kidney disease. And it's not simply the cost, it's not simply the quality of life, it's not the suffering, it's the easy life. You can protect your kidney for 100 years, even if you have diabetes. And there are mechanisms. If you look at the Western world, United States data, United Kingdom data, if I'm not wrong, 30% kidney diseases come down. And the more would come down because they treat their diabetes well, they treat their blood pressure well, they treat their cholesterol well, they understand about it, and the treatment done. The best thing is to prevent all this thing happening and make sure we control that. So it's very important to avoid NSAID group. Take crocin or paracetamol or Calpol for pain. If you have a much stronger painkiller, please discuss with your physician, whosoever your doctor is, and make sure you don't take NSAID group, which can damage your kidney. For a short period, you can take it. For a longer period, we have to avoid it. You can take certain painkillers, which can be neuropathic painkillers like pregabalin or gabapentin, don't damage kidneys. That can make you sleepy or drowsy, but they are fairly safe from the kidney point of view. But crocin is the safest one. Any medication you take beyond crocin has to be discussed with your doctor. So that's all from my point of view from this episodes of diabetes and kidney disease. So be safe, get your blood pressure, diabetes, get your tests done, control medications. Certain class of medications need to be prescribed at a maximum dose. For example, on ramipril, 10 milligrams of ramipril and telmisartan 80 milligrams needs to be for a renoprotective effect. The kidney function needs to be watched regularly, and make sure if you don't have kidney disease, at least annual kidney function test, at least leukoprotein or microalbumin or albumin creatinine ratio needs to be listened annually. If it's done one positive, repeat again and keep an eye on it. Avoid any renal toxic drug. Please don't pop in any medication just thinking it's not going to damage it. We know what medication can damage, but all these alternative medications may not understand at what can damage. So it's very important to avoid it. And if you ask any of my nephrologist colleagues, they all say these Ayurvedic medications have long capacity to damage your kidneys, and they don't understand. And then sometimes, we really get frustrated that we can't say in open public about all this because I don't know what's going on in the country, but somehow this Ayurvedic medications, untried, untested, needs to be controlled very aggressively so that we protect your kidneys very well. So I'll end the chat, here.